Welcome to the only patient advocate podcast you'll ever need. In this podcast, you'll learn how to advocate for yourself and your family, and where to turn when if that becomes overwhelming. Now, here's your host, Joyce Schulz-Killian, registered nurse and owner of At Your Request Patient Advocate, LLC. She is your private patient advocate. Here at your request to communicate, educate, and advocate with and for you.
Hi, I'm Joyce Schulz-Killian, a registered nurse for 27 years and in healthcare since I was 18 years old. I'm the owner of At Your Request Patient Advocate, LLC. I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. Find me on Facebook at Your Request Patient Advocate and on Instagram at JSKICURN, and on Twitter at RN Advocate for you. Hit like and subscribe if you like what you hear, and tell a friend. And I'm also always taking suggestions on the next podcast to do. So today we're going to be talking about social determinants of health. The social determinants of health are conditions by which persons are born, live, socialize, go to school, work, age, and ultimately die. These are important because they help determine health outcomes for all, but especially the most vulnerable populations, which has now expanded. Addressing social determinants of health is important for improving health and reducing health disparities for everyone. You would think your health would dictate how long you live, but no, there are other factors involved that determine your life expectancy, and they include all the social determinants of health. There are 5 domains of the social determinants of health, SDOH, and they were recently updated for Healthy People 2030. Healthy People 2030 sets data-driven national objectives to improve health and well-being over the next decade. They recently updated, and it is done by the U.S. Department of Health and Human Services. They have determined these 5 social determinants of health. If ever I get my master's in public health, I would do my practicum on the social determinants of health and how they affect our longevity. Economic stability is the first social determinant of health. Education, access, and quality is the second. The third social determinant of health is health access and quality of health care. The fourth is neighborhood and built environment. And the fifth social determinant of health is social and community content. These factors used to be prominently describing a limited number of people based on demographic and socioeconomic class, but now cross almost every demographic and incorporate homeless veterans, victims of human trafficking, families struggling to manage high copays, deductibles, and other types of medical debt, persons with chronic illnesses, victims of domestic violence, and let's add over 40 million unemployed from pandemic-related employment, furloughs, layoffs, and other change. So almost all of us. Actually, it is all of us. Economic stability. In the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy foods, health care, and housing. Healthy People 2030 focuses on helping more people achieve economic stability. Economic stability includes employment. Whether you are employed or unemployed make a huge difference in how long you live, believe it or not. Anyone in the entertainment field, be that entertainment or the hotel, motel, travel industry, or dining, suffered and may still be suffering due to the pandemic. People are committing suicide. So obviously the ability to have employment or not have employment and have income does affect our well-being. Income is another factor. Lots of people work jobs that leave them living in poverty, and the pandemic did not help debt. Medical bills fall under this category, as we all know the skyrocketing costs of medical care. Support, meaning support you as an individual have in the world. Do you have a big support system, or not so many, or even anyone to rely on in case of need? As you can see, these things would definitely impact your life in ways that affect your life expectancy. In areas of socioeconomic disparity, employment may not be accessible, which directly affects your income. Low household incomes cannot afford standard health care and may not have access to insurance either. They are more likely to put off seeking help for conditions that warrant immediate attention, such as heart attacks, strokes, open sores, or wounds. They may not have access to healthy food options like fresh fruit or vegetables. They may face hunger on a daily basis. They may already have medical bills that they cannot pay and other expenses that limit their ability to provide better for themselves. Education, access, and the quality is one of the social determinants of health, which includes literacy, the ability to read and write or understand something. Language is important. There are still many people whose primary language is Spanish, and that may limit their ability to work or get what they need, where a dual language person may have more opportunities. This health determinant also includes access to early childhood education, the education from birth to kindergarten, that area where it's not necessarily needed, but it is really needed. Access to vocational training and a higher education positively impact the social determinants of health, and starting school earlier. As you can imagine, a good education will take someone a lot farther along than a poor education or no education at all. It affects the type of job we have. And I'm not talking about school education. I'm talking about any kind of education, a trade education, whether it be schooling or learning a trade. That's all education. That's all knowledge that we acquire. Where we are able to live, as well as how much we make, are affected by our jobs and our education. Education early has been studied over and over again and proven time and again to have a positive effect on a child when started earlier rather than at the standard of kindergarten. Preschool, pre-kindergarten is more than just education. It is literally molding the individual's emotional and critical social skills between parent, child, and teacher, and if done well, has shown to lay the foundation for a great long-term result. The next determinant of health is health access and quality, meaning the availability of access to health care and the quality of that health care. About 1 in 10 people in the United States don't have health insurance. People without health insurance are less likely to have a primary care provider or a medical doctor, and they may not be able to afford the health care services and medications they need. Strategies to increase insurance coverage rates are critical for making sure more people get important health care services like preventative care and treatment for chronic illnesses. The Affordable Care Act is still active and heading to healthcare.gov. The plans are marketed by area, so an area of lesser socioeconomic development should have lower rates for health insurance, and it is based largely on area and income. I remember my niece applying, and because of the area she lived in, the specific county, her insurance was quoted at an extremely low rate to provide quality insurance for her whole family. That was her, her spouse, and all of her kids. We are in an open enrollment for insurance with the Affordable Care Act. One never knows, so you just might want to try. Just see what they have to offer. If you see high deductibles and things like that, then move on to the next one. So now you have insurance, but what about the quality of the care you're receiving? My brochure says you just don't know the questions to ask if you just don't know. Is care available to you in your area? Do you have to travel far to reach the services? Is there access to transportation to get to those services? Does the provider speak your primary language? Does the healthcare offer quality to you and your life? How will you know if the quality of the care you are receiving is up to par? Well, are you feeling better? Is your condition managed? Are your vital signs like blood pressure, pulse, heart rate under control? Are you experiencing symptoms out of the ordinary? You know your body. Do you understand the plan the doctor has implemented, and have they explained it to you so you understand it? Ask questions. I have those sheets, what to do when you go into a doctor's appointment, the questions to ask, talking about your medicines, things like that. We provide all those access to you free of charge. You can have those sheets, those questions to ask. These conditions described impact the health outcomes greatly. It pays to know your doctor and build a relationship with them so they can effectively treat and help to manage your conditions. The next determinant of health is neighborhood and built environment. The neighborhood and physical environment you live in. This includes housing, where you live, transportation to and from places like shopping, areas of recreation, and your job possibly. Safety falls under this determinant. Safety in your home neighborhood and while traveling around the neighborhood. The availability of parks and playgrounds falls under this determinant, and the safety and accessibility of those also. Are the parks close to you? Can your children go play at them without the fear of being shot at? Walkability. You see this when looking at houses. It talks about the ability to walk to key places like schools, libraries, stores, and parks. As you can see, zip code plays a large part in how long a person lives. Think about it like this. The people in Chicago have increased disparity just because of the high rate of shootings in certain neighborhoods there. Their safety is in jeopardy every day, some even while sitting in their homes or driving on the interstate. What are the resources available in your area? Are there youth groups and social organizations you can get involved with, your kids can get involved with? Is there a neighborhood watch committee? Are stores close for fruits and vegetables and healthy food choices, or do you have to travel far? Can you even afford these healthy food choices? Some ERs in New York started providing bags of healthy foods to their clients upon discharge. Each bag contained 1 to 2 days of shelf-sustainable food. After the first week of operating the program, they realized that many of the emergency department's patients didn't have the ability to cook at home. For example, patients who were homeless. So no cook, no can opener meals were packaged for them. Funding for the program was provided by the Bellevue Association, a public-private partnership dedicated to supporting Bellevue Hospital's mission through existing funds and new fundraising for the program. How great would that be if all the ERs across the United States provided a bag of food to their ER patients in need upon discharge? That would be amazing. That would be a game changer. The last social determinant of health is social and community content. People's relationships and interactions with family, friends, co-workers, and community members can also have a major impact on their health and well-being. Healthy People 2030 focuses on helping people get the social support they need in the places where they live, work, learn, and play. Many people face challenges and dangers they can't control, like unsafe neighborhoods, discrimination, or trouble affording the things they need. This can have a negative impact on health and safety throughout their life. Positive relationships at home, at work, and in the community can help reduce these negative impacts. But some people, like children whose parents are in jail and adolescents who are bullied, often don't get support from loved ones or others. Those are the people we need to help. Interventions to help people get the social and community support they need are critical for improving health and well-being. Big Brother organizations and other youth organizations can help the youth and offer opportunities to adults to volunteer to help the future of our country, our youth. How is your support system these days? Do you have family close that can help if needed, or are you alone? Now, how does this impact me? Well, by becoming aware of these social determinants of health, you can see where you fall on the spectrum, and then you can try to find resources to improve your situation, whether it be education, a new place to live, building a social support group, trying to earn more money, developing your education. Sometimes that's easier said than done. It is hard to break patterns and get out of situations life has placed us in, but knowing which situations you can change and which ones you can't might help. It's easier to make healthy food choices or try to move your body for 30 minutes a day than it is to move to a new neighborhood. Do the things you can do and slowly work on the other platforms as time and access warrant. I hope this was informational to you. Meditation can be learned and is free. It helps reduce anxiety, a leading contributor to health issues. Control the things you can and try to slowly work on the harder things. My last advice is if you are a caregiver for someone, take care of your basic needs first. So you cannot care for someone else if you do not care for yourself. So as you can see, addressing the 5 social determinants of health and attempting to make changes in vulnerable populations will help us all live longer and, more importantly, have the good quality of life during our lifespan. That is truly the goal of Healthy People 2030 initiative, to increase the positive life experiences and decrease the ones that cause disparity, thus increasing lifespan. And on that note, I would like to thank you for listening. If you like what you hear, please hit like and subscribe and tell your friends. I would like to thank everyone who helped me to take the plunge into this podcast and with all my dreams I've had in the past 8 years. Remember, I am your private patient advocate, and I'm here at your request to help you navigate the healthcare system one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at Your Request Patient Advocate, and on Instagram at JSKICURN, and Twitter at RN Advocate for you. Hit like and subscribe and tell a friend. And I'm also looking for suggestions on future podcasts. I'm sorry I missed last week. I had a family emergency and did not have a chance to record. And I might be taking some more time off as the podcast, and let the podcast see how it does in the future, and send me your ideas. You can always text me at 847-809-1214, and have an awesome day.